Uh, Good morning. I'm here to present my study titled Clinical Profile of Acute Primary Angle Closure Glaucoma After Laser Peripheral Iridotomy. Glaucoma is the second leading cause of blindness in the world, and in India accounts for 11.2 million, of which primary angle closure glaucoma accounts for 2.54 million. Acute primary angle closure glaucoma is a vision-threatening emergency, and it is a major cause of glaucoma blindness globally. Objective of my study is to study the socio-demographic and clinical factors affecting the outcome of laser peripheral iridotomy in patients diagnosed with acute angle closure glaucoma. Methodology. The study is designed was a hospital-based prospective observational study. It was done in the OPD and casualty of Tertiary Care Eye Hospital of South Kerala. And study population included patients presenting with acute angle closure crisis in the OPD or casualty. The sample size calculated was 40. And my inclusion criteria includes patients more than 40 years of age and who were diagnosed with acute primary angle closure attack, and patient willing for laser peripheral iridotomy, and patient willing to give consent. Exclusion criteria include bilateral acute primary angle closure attack, secondary angle closure, chronic angle closure glaucoma, previous intraocular surgery, and reported history of pre-existing glaucoma at the time of acute primary angle closure, and incomplete clinical data or patient not willing to give consent. A data collection tool, Prof was used to obtain the patient details, and Snellen vision acuity chart was used to assess the vision of the patient, and wet retinoscopy, and Goldman applanation tonometry was used to measure the IOP, and slit lamp examination was done to visualize the anterior segment of the patient, and gonioscopy with Goldman 2 mirror was used for assessing the angle status of the patient. Study variables, socio-demographic variables, best-corrected visual acuity, refractive error, anterior chamber status, intraocular pressure. All these were assessed at the time of presentation at 2 weeks, 1 month, 2 months, and 3 months. The results of my study. Percentage distribution of angle according to the age. About 60% of the patient was at the age group of 51 to 60, and 85% were females. 60% had hypermetropic refractive status of the eye. On assessing the best corrected visual acuity of the patient in logmark unit, before the treatment, 87.5% of the patient had was between 0 to 0.3 logmark unit, and after 3 months of study, 95% were initially 87.5 was between 0.3 to 0.6 logmark unit, and at the end of 3 months, 95% were having visual acuity between 0 to 0.3. And IOP, effectiveness in intraocular pressure, before the treatment, 87.5% of the patient had IOP between 31 to 40, and after 3 month period, about 87 had an IOP less than 20. It was clinically significant. Angle status of the patient. Angle status before the treatment, all 100% of the patient had a closed ankle, and at 3 month period, about 82.5% of the patient have an angle opened in 3 quadrants. Then percentage distribution of anti-glaucoma medications. Majority of my patient had to take, 75% of the patient had to take 2 anti-glaucoma medication. Outcome of my study, I have assessed the ideal outcome of my study was the patient just has to use laser PA, and his IOP without any medical therapy, his IOP was less than 21. The desired outcome was with laser PA, he had to use a medical therapy to decrease his IOP less than 21. And a failed outcome was the laser PA with medical therapy, but IOP was more than 21. So 85% of my patient had a desired outcome. Discussion. In my parent study, Lee et al., a successful IOP control was seen in 59.7% of the patient after laser PI, and the mean age group was 66 in that study, and 76% were female, and the mean IOP was 52.6 millimeters of mercury. In my study, IOP control was obtained in 87.5% of the patients, and the mean age group was again 51 to 60, 85% were female. And the IOP was between 31 to 40 in 35 out of the 40 patients at the time of presentation. And in Andretta et al., the best corrected visual acuity was at 6-month period was 86% were between 0 to 0.3 log mark. And again here the 76% were female and mean age group was 69 and the mean IOP was 53. In my study, the best corrected visual acuity at 3 months was 95% between 0 to 0.3 log mark. And the mean age group was 51 to 60 and 85% were female and 35 out of the 40 have IOP between 31 to 40 millimeters of mercury. And Jovina Ellis et al. Study, here also their successful treatment with laser PI was with 42 to 72%. In my study, it was 87.5%. In conclusion of my study was that the laser peripheral iodotomy following an acute angle closure attack along with anti-glaucoma medication, when done promptly, is able to control the intraocular pressure and improve the visual acuity and thus control the burden of the disease. These were my references. Thank you.
I think you mentioned something about 31 to 14 or something.
Age group, sir.
Age group. No, something IOP control.
IOP, yes, sir.
31 to 14. 3-1.
Yes, sir.
3-1 to 14.
40.
40.
40, yes, sir.
That is.
Majority of my patients before treatment were between 31 to 40.
Oh, after giving PI?
After laser PI, majority had IOP less than 20.
Less than 20. Anyone above 25 or something? Remaining?
Yeah, there were patients, sir.
For them, what did you do?
Anti-glaucoma medications were given to control the IOP. And if it was not controlled, then surgical treatment was advised to them.
It would have been open angle glaucoma also, no?
It could be open, combined open angle glaucoma. Anti-glaucoma medications was used for 75% of the patients.
What drug you have used?
Sir, Dorsox and Timolol was used, 2 drugs.
What?
Dorzolamide and Timolol.
Dorzolamide. Achha. And Timolol.
Timolol, 2 drugs.
Both are having same decreasing secretions. Why do you want to combine both?
Yes, sir.
See, Dorzolamide also decreases secretion.
Yes.
Timolol also decreases secretion. Why do you want to combine a 2 drug which can
No,
have got the same effect?
No, some were using Timolol alone, some were using Dorsox.
Achha. Okay.
Any optic disc changes or field changes observed in any of these cases?
No, madam. Majority of the patient does not have any optic disc changes. Field changes was there in 12.5% of the patients had a moderate field change.
What type of field defects?
Moderate field change was there, ma'am. Small scotomas.
Without any changes in the disc?
Yes, madam.
Thank you very much. Very nice session we had and fantastic papers were presented. Thank you very much.